Hi, everybody. I'm Dr. Leslyn Keith, and I'm a certified lymphedema therapist, and I've been treating people with lymphatic disorders like lymphedema and lipedema for over 25 years. My channel really focuses on bringing you the most up-to-date information on research as it applies to lymphedema, lipedema, and metabolic disorders. Today, I'd like to share with you a presentation that I had intended to deliver at the Mayo Clinic in May, but the conference was canceled. So I hope to be able to present it sometime in the future, but I wanted to share it with you today. So this is the presentation, and what they wanted to hear about was nutrition for lymphedema and lipedema. And so what I wanted to talk about was what would be the ideal nutrition plan for lymphedema and lipedema? What would be the essential components of that plan? Well, the eating plan should be safe for long-term use. It should manage or reduce the symptoms of lymphedema and or lipedema. It should reduce the burden of self-care practices that are required to manage lymphedema or lipedema symptoms. And it should be able to accommodate modifications that individuals may need. So it should have a variety of things to choose from depending on your needs. And lastly, it should be sustainable. So let's talk about therapeutic carbohydrate reduction and how that would apply to these essential components that are needed for a nutrition plan for lymphedema and or lipedema. So therapeutic carbohydrate reduction, or TCR, is a dietary approach that limits carb intake to 130 grams per day or less. So the typical intake is around 250 to 300 grams per day. So we're talking about maybe half of that or less. And it really focuses on reducing the sugar, grains, and starches from the diet and shifting the focus to healthy proteins and fats, all to improve health. Some general guidelines for eating this way, provided by Dr. Benjamin Bickman from Brigham Young University in Utah, is to control your carbs, prioritize proteins, and fill in with fat. Pretty easy to remember that way when we have that little saying to go with it. So the therapeutic carb restriction diets are really a range. There's a spectrum on how much you're going to reduce your carbohydrates and how much you're going to be eating mostly plants or mostly animal source foods. And so on the left, you can see that that's more plants that you're going to be eating, and it could be described as the so-called Mediterranean diet. And so it's still going to be some carbohydrate restriction and eating a lot of plant-sourced foods. And then low carb, ketogenic, and carnivore is gradually fewer and fewer carbs and much more towards the animal-sourced end of the spectrum. It is very interesting to note that many of the new papers on guidelines for lipedema management are talking about using somewhere on this spectrum, some kind of carbohydrate restriction is going to be preferred and most effective for lipedema. And so since 2021, when the US guidelines came out, and then followed by Germany, Brazil, and then the Lipedema World Alliance earlier this year in 2026, they all mention this spectrum, Mediterranean low carb or ketogenic diets, for the best way to manage lipedema. So let's talk about how does this dietary style, does that meet those criteria that we're talking about, the best way to eat for lymphedema and or lipedema? So first, is therapeutic carbohydrate restriction safe for long-term use? And because the ketogenic diet is one of the most studied diets over the last 100 years, that has been shown to be very healthy and a nutritionally adequate way of eating. And mostly this is because carbohydrates are not essential. Protein and fat is essential. And so if we reduce carbohydrates in our diet, it is safe and it's very effective at managing health, and it can be definitely nutritionally adequate. The adverse effects to eating this way are minimal, and that's been shown in a wide range of studies as well. And then it should be stated that if you have a lot of comorbidities, especially those that require medication to manage, like high blood pressure or diabetes, then when you change to this way of eating, it may be safer for you to be monitored by a professional. I would like to suggest to you that here are several provider directories where you can find someone to help you manage and monitor you as you're using this way of eating. The Society of Metabolic Health Practitioners, Canadian Clinicians for Therapeutic Nutrition, and the Nutrition Network. There are a lot of providers on all three of these lists that provide online telemedicine support. So this is a safe diet for long-term use. Now, is this way of eating useful for managing or hopefully even reducing the symptoms of lipedema and or lymphedema? And first is the consideration of pain. And this is much more common in lipedema, but it does also happen in lymphedema. The studies that I show here are all looking at patients with lipedema. And one of the first symptoms that is managed, sometimes within 2 weeks of changing to this way of eating, is pain. Excessive body fat or changing your body composition as an improvement, that has definitely been shown to be an effect of this way of eating. And you can see that demonstrated here on the right. This is a study with women with lipedema and before and after using a ketogenic diet. And you can see that even the lower body that's affected by lipedema reduced in fat. And then here is a couple of 2 studies that are showing the effect of this way of eating on an edema or swelling or just the size of a limb. And these are both studies on patients with lymphedema. The first is my pilot study, and another is a pilot study out of Belgium. And with this way of eating, they did reduce their limb size and the swelling volume. And then Robert and Erkstrom and I did a paper in 2023 where we presented a group of patients with lymphedema who used this way of eating, and they decreased in fatigue and increased in energy level. And then lastly, looking at immune function, this is an issue for people with lymphedema, that they get repeated infections. And this study here in 2022 showed that people who use this way of eating had reduced incidence of infections. So this is a reasonable diet to use to manage symptoms of lymphedema and lipedema. Then, can this way of eating make it easier to manage lymphedema and or lipedema? This is a poster presentation that Dr. Gabriele Ferber from Germany and I did for a lymphedema conference. And what she showed with her patients who used this way of eating, that they needed to use compression garments less. And if they still used compression garments, they needed to use a less firm or less strong garment. And so that was easier in the managing of their edema, that they didn't have to use such strong compression or as often. And then this is a result of my pilot study. I used the Lymphedema Life Impact Scale as one of the outcomes. And the patients who used a ketogenic diet had a 43% decrease in the impact of lymphedema on their life. after they had used this way of eating. So that showed that it was probably less of a burden to manage their lymphedema. And the same thing was showed in another outcome measure that I used on that pilot study. And it showed that they had showed a 94% increase in ability to do daily activities. They were just easier and they did them better. And that was only in the group that used the ketogenic diet. So I would say that this way of eating can reduce your burden of self-care practices that you have to use to manage your lymphedema or lipedema. And then can this way of eating be modified to accommodate the needs of different people? And definitely this way of eating can definitely be personalized for different conditions that you may have, what your medical history is, what your current health status is. You may use different versions of a ketogenic or low carb diet over your lifespan. It can accommodate your preferences, such as cultural, social, or just your taste. It can accommodate if you have allergies or intolerances to certain foods. So this way of eating definitely can accommodate any modifications that you need to personalize it. And is this way of eating sustainable? And we look at the picture on the right, that these are normal looking foods that you would see at the grocery store, nothing unusual there. And all these foods are palatable and enjoyable. They're satiating, much more satiating than high carbohydrate foods that tend to make you hungry just in an hour or so. And they would help you reduce cravings. People who eat this way have reduced cravings and are able to not eat in between meals. They have a less need to go after previous foods that they could seem to do without. And it is affordable. This is not an expensive way to eat. It definitely can be culturally and socially acceptable. When you look at all these foods here, if you were to have someone over for dinner and you offered these foods, it would not seem unusual. And so this way of eating definitely can be sustainable. So that is my presentation that I intended to give at the Mayo Clinic there at Rochester, Minnesota. Unfortunately, the conference was canceled. We hope it's going to be scheduled again in the future, but you got to have a little sneak peek of what I would have presented there. And so what I would just like to close with is, if you would like any more help or support, or would like to find out more about lifestyle and specifically nutrition for lymphedema and or lipedema, then be sure to find out more about my program that I do with Robert Erkstam, Lymphatic Lifestyle Solutions. You'll see a link and more information below. We do provide a free webinar every so often, so you can find out more. And then also check out my book, The Lymphatic Code, where I talk about lifestyle practices and especially reducing carbohydrates to help manage your lymphedema and lipedema. See you next time.